Thank you very much. So like she said, my name is Dr. Kevin Heaton. Just some background. I'm from Southern New Hampshire. I grew up in Amherst. I went to Souhegan High School. That usually gets booze around here. But I went to University of New Hampshire, and then I did residency and fellowship at Boston University. And last year I was one of the team physicians for BU and MIT. And now I'm working at Access, and I'm going to be your team physician for this year. I'm really excited to work with you. So I'm here today to give you a brief talk on concussions and the concussion management protocol that we have for you. And so I know you guys have a lot to get to today, so it's going to be brief and should only be about 10 or 15 minutes. Some quick concussion facts. There's over 300,000 sports-related concussions in the United States every year. According to a 2007 study, concussions were responsible for up to 9% of all athletic injuries. So, I mean, that's a pretty remarkable number, that out of all injuries, 9% of them were concussions. And it's really important for early identification and treatment of these concussions so we have the best possible outcome. So what is a concussion? A concussion is a trauma-induced functional neurologic deficit. So what does that really mean? It just means that any forceful blow to the head or body that causes rapid movement of the head, it can lead to changes in the way the brain functions. Loss of consciousness is not required to diagnose a concussion. And as a matter of fact, most concussions are not associated with loss of consciousness. So it's just an important fact that you can have a concussion, and usually a concussion is not associated with loss of consciousness. I'm going to play a quick little video that kind of highlights what a concussion can look like, and many of you probably have seen this before. So this is Big Baby Davis, and as you saw, he was trying to get up. He actually did lose consciousness for a couple of seconds. Was slipping around on the floor, had horrible balance. You know, very dazed and confused when he comes over to the bench. Certainly this was a concussion. So he really showed a lot of the common signs that we see with a concussion. So signs are things that you will see in a concussed person. So they're going to appear dazed or stunned, confused about what's going on, forgetting plays, unsure about the game, the score, the opponent, acting clumsy, answering questions slowly, losing consciousness, showing behavioral or personality changes, and not being able to recall events before or after a hit or a fall. So those are all common signs. Common symptoms. So this is the complaints that the athlete has. So what are they telling you? So they're going to tell you, I have a headache or pressure in the head, nausea or vomiting, balance problems or dizziness, double or blurry vision, sensitivity to light or noise, feeling sluggish or hazy, foggy or groggy, having poor concentration, confusion, and really just not feeling right is oftentimes what you'll hear. So why is this important? It is very important, and that's why there's a lot of press about concussions these days. We know adolescents typically have worse symptoms than adults, and those symptoms typically last longer than adults. We know that concussions cause additive effects, so that means that the concussions, when repeated, they can occur with less and less force, and then the symptoms can occur for longer and longer periods of time. We also know that following concussion, you're at a much higher rate for a repeat concussion. There's also the possibility of something called second impact syndrome, and that is where you sustain a concussion, and if you sustain a second hit to the head before your symptoms have resolved, there's a possibility that you could have a lot of swelling in your brain, and this could lead to death. Now, this is very, very rare, but it is a possibility. And the last is chronic traumatic encephalopathy, and this is getting a lot of news these days, and a lot of the research is actually coming out of Boston University, and you may have heard about this, about all the NFL players donating their brains for research, and that's for this, chronic traumatic encephalopathy. There was a brief little video that I was going to show you, but the audio isn't really working, so I'm just going to skip that. But basically, over a long period of time, with sustained hits to the head and concussions, you're at increased risk for this chronic traumatic encephalopathy. And it can cause things like depression, memory loss, and dementia when this occurs over a long period of time. So it's important just to recognize this. I don't want people to be scared and say, oh, we shouldn't allow our kids to play contact sports at all, because we know that exercise is certainly, the benefits outweigh the risks. But just it highlights the importance of properly managing concussions. So, on to the concussion protocols that we have at Winnacunnet. So the first one is preseason baseline impact testing and education. So talks like this. So what is impact baseline testing? So impact testing, it's a neurocognitive test, and it's designed to assess brain function. It's going to test things like verbal memory, visual memory, motor speed, and reaction time. And what we do is we take a test at baseline, so before you've ever had a concussion. And then we're going to compare that, if you do have a concussion, we're going to be able to compare the scores to see how they relate to one another. And it really helps us assess resolution of neurologic impairment. So it is one piece of the assessment in the return to play protocol, and a very important one. So we can take this online, so Access Sports Medicine has made this free and accessible to everyone. You can take it online, you can go to our website. There's a link for concussions, and you can take this. It's a 20-minute test. You can take it at your house, and this should be taken freshman year and junior year. So it should be taken at least twice during your 4 years of high school. So it's very important to make sure you have this baseline. So as far as the protocol goes, so first step is if there's a suspected concussion during a game of practice, you're going to be removed from play immediately. Initial assessment is going to be done by Aubrey. And then, obviously, if there's any worrisome signs, then that patient will be sent to the emergency room. If not, there's something called SCAT2 testing that basically we do at the time of the possible concussion, and we use that for formal diagnosis. After the concussion has been diagnosed and there's no worrisome signs, the student athlete will get a verbal and written home instructions, and basically that's going to, the most important thing about those instructions is cognitive and physical rest. And we're also going to make sure that the parents are always notified in each case of a concussion. So what do we mean by rest? So there's physical rest and there's cognitive rest. So physical rest is really no activity that gets your pulse or your blood pressure up. So really, what can you do? You can eat, drink, sit, walk, and sleep, but we don't want you really doing anything else but that. No exertion whatsoever. As far as cognitive rest, this is a little bit tougher. And so we really want the student athlete to avoid reading, any test taking if possible, texting, phone calls, prolonged periods of time on a computer, video games, or even watching TV screens. We've even seen episodes where the person who's concussed goes and just watches their practice, and sometimes even the cognitive exertion of just being involved in watching others play can even give them worsening symptoms. And oftentimes this may require special school accommodations with your teachers. So after they've been sent home with these instructions, we want them to follow up with a physician who has experience in treating concussions, at least within the first few days. So this could be with your own primary care doctor if they have familiarity with how to treat concussions, with myself at Access Sports Medicine, or with myself at the school. And again, I'll be here every week. The athletic trainer is going to follow that player at school daily, so they're going to monitor the symptoms, they're going to make sure that nothing is worrisome, and they're going to communicate with me as needed. Again, like I said, I'll be in the school every week, and when I am in the schools, I'll be personally examining those athletes who have a concussion. Once all of their symptoms have resolved for at least 24 hours, this means that they feel completely normal for over 24 hours, then we start a graduated return to play protocol. During that return to play protocol, the impact testing that I talked about before, the neurocognitive test, that's going to be repeated. So now we're going to repeat that, and we're going to compare the scores, and we're going to make sure that they're similar. And that's going to help us give a clue that that patient is safe to return to play. We'll base it on the impact results, balance testing, and on the patient's symptoms. Just to give you a little bit perspective on how quickly people can get back to play after a concussion, I just want to highlight that 6 days is really the soonest you could possibly get back, and that would be if symptoms resolved immediately. And so typically, the symptoms do not resolve immediately. So most of these athletes are going to take longer than 6 days. Adolescents, like I said before, typically have a longer duration of symptoms, and for that reason their return to play should be more conservative. And really we just want everyone to have a safe return to play. So that's really it for my talk today. I don't know if anyone has any questions about the protocol or any other questions. Any questions at all?